The baobab tree, revered across Africa for its resilience and generosity. Storing life-saving water in its succulent trunk, its shade offering refuge, its hollow heart a sanctuary. A symbol of survival, strength, and shelter in even the harshest conditions. These are the very values that guide us.
So the Baobab Research Programme Consortium is truly a pioneering Africa-based and Africa-led program, and we are seeking to fill the gaps in our understanding of the sexual and reproductive health and rights of individuals in refugee settings. We are bringing rigorous surveys into refugee settings for the very first time, and then we are using the findings from these robust surveys to inform interventions that have the potential to respond to the most critical gaps.
What we did, the first humanitarian violence against children survey, is very, very resource intensive in terms of money, in terms of expertise, in terms of time.
When we brought the HVAC's findings into a multi-stakeholder data to action workshop that brought together government stakeholders and humanitarian actors, we've really felt this sense of urgency. The data highlighted a major gap when it comes to traditional systems because they weren't identifying children in need of support, so survivors weren't coming forward and the services weren't reaching them. This sparked a critical question. What if we didn't wait for children to disclose, but instead we would set up a proactive way to identify and support them, particularly in schools where they spend most of their time? So this school-based screening intervention was piloted in 2 primary schools in Chirindongo refugee settlement in Uganda between April and October 2024. And it's truly a comprehensive model as we first trained parasocial workers who were responsible for screening the children. And then we also conducted sensitization sessions with students and parents, and then parasocial workers went on to screen the students.
In a space of just 3 months, we were shocked at how big the magnitude was. We got over nearly 650 cases in a space of 3 months. When we compared that data with the data that was there before on the same, they had only identified about 43 cases for the whole year. The other interesting thing we found is that boys came up. There were more than the girls reporting these cases. And yet the general feeling shows that boys are not that violated.
What's even more important is that no child survivor fell through the cracks. So all children who had disclosed having ever experienced sexual violence received on-site first-line counseling, and 25% of them were referred for additional services, whether medical or psychosocial.
Now, we are absolutely thrilled that Uganda's Ministry of Gender, Labour and Social Development has integrated Baobab's sexual violence screening modules into its national parasocial worker training manual. And they've gone ahead and secured external funding to pilot the revised curriculum in a new district.
We think that this is a revolution we are starting because until Baobab came in a few years ago, no one thought that some of these surveys could actually be applied in humanitarian settings because of their volatile nature. But we showed it's possible. Not only did we conduct one in Uganda, we also went ahead and conducted a second one in Ethiopia.
These 2 surveys that has been done with Baobab in collaboration with SRHR, that really enable us just to get better evidences, just to make evidence-based decisions, really gives us a bigger picture about the impact of violence against children and youth in humanitarian setting. In the future, the approach that Baobab is following is really very key, just to sustain and also just to expand the success and the lesson that you are already get from the engagements.
We are acutely aware that we're only at the beginning of driving meaningful change, and there's still so much more to do. But we're encouraged by the progress so far, and we remain deeply committed to building on this momentum together with supportive partnerships.
Baobab's data on unintended pregnancy and unsafe abortion has led to the exploration of other innovative interventions. These include integrating family planning referrals into food distribution platforms to proactively reach women, while staying rooted in community-led research, capacity building, and cross-border adaptation.